So I was interested in a career in laboratory medicine because from an early age I knew I wanted to be a scientist and I wanted to work in a hospital laboratory. So after I graduated with a bachelor's degree, I participated in a 12-month clinical internship at a local hospital and graduated, and I immediately joined AACC.
AACC is all about professional enrichment. And so like anything else in life, you get out of something what you put into it. So I became an AACC member in 1978 when I was a second-year graduate student. I went to a meeting and it turns out that Rosalind Yalow, who had won the Nobel Prize for development of radioimmunoassay, was the keynote speaker, and it was one of those life-changing events.
Quo Vadis was seeking answers for one of their recent questions, and this is a format for younger people to answer a question about kind of the future of the profession. So one of my trainees answered the question, and it was published. And I talked to another colleague who said, "Oh, hey, I saw your trainee answered this question, and I know she's looking for a job, so have her call me for sure." And as it turns out, this individual is probably going to end up going to work for this person who read her question.
I've served on the boards of the American Board of Clinical Chemistry, the AACC, as well as the COMAC, the Commission on Accreditation in Clinical Chemistry. As of 2012, both of these organizations have contracted administrative support from AACC. AACC support provides structure, continuity, and context that is so important for our profession and the field of laboratory medicine and clinical chemistry.
I published a paper that was out there, and I got a call one day from a guy in industry and just said, "Hey, I saw your paper and I was kind of interested in your line of work. Could we maybe meet at the annual meeting?" And so he and I met at the annual meeting, and we had breakfast and talked about the paper and hit it off really well. And I've probably had, I don't know, more than 10 years of collaborative research then with this company, really based out of a breakfast that we had at the annual meeting.
I think that the biggest change we're going to see in the next decade or so is the role of the clinical chemist or the clinical laboratory professional to being more of a consultant, to assist the physician with the proper ordering of tests and the proper utilization and interpretation of those tests to control costs as well as optimize information for patient management.
We're changing the model of reimbursement. A lot of institutions are developing accountable care organizations. A major source of information that helps to provide healthcare accurately is laboratory tests. And although it's a very small amount of the budget, it's a very large percentage of the information that exists. So there's going to be an important role for laboratorians assisting physicians in selecting laboratory tests in an efficient way and in interpreting those tests to providing excellent healthcare outcomes.
No longer can it be just driven by cost or by price. We can't do things that we've always done. We need to really focus on the value of laboratory tests in guidelines and in improving outcomes for patients.
Since Lab Tests Online started a little over 10 years ago, we've had about 150 million people worldwide, and now in a total of 17 countries and 14 languages, who've learned about what laboratory tests mean. And this year alone, we'll have about 33 million people who visit Lab Tests Online.
AACC has a very strong international reputation as a trusted source for reliable information about laboratory testing and laboratory medicine in general. And we need to continue to provide products and services for members that make it easy for them to find that information and know that anything they get from AACC can be counted on in the daily practice of lab medicine.